Well, if you or someone you know suffers from neuropathy, then you know the numbness, the tingling, the stabbing, the burning pain can make every day an excruciating battle. Dr. Nathan Weller from Restore Wellness Center is here because you know what? He says he can help you. You are not going to believe the type of treatment that he is doing that's really working. But first of all, welcome to Sonoran Living.
Thank you. Thank you for having me.
I am excited that you're here because I've already learned a lot about the types of treatments that you're doing. But explain to everybody really what is neuropathy?
So neuropathy is nerve damage in the feet, legs, hands, or arms. A lot of different fibers, a lot of different symptoms, like you mentioned, numbness, tingling, burning. We have patients say they feel like they have bunched up socks underneath their balls of their feet.
Oh.
They're not sleeping at night, they're not walking. It's a terrible condition.
It really is. It's all about quality of life, and it really gets in the way. So
Yep.
Traditionally, we have heard a lot about the types of treatments out there. What is everybody else doing that isn't really working?
So the traditional types of treatment, you go to your doc, you go to the Mayo Clinic, you go to your neurologist, wherever it is, and they're going to prescribe you a medication called gabapentin, Lyrica, Neurontin, Cymbalta, some type of pill to mask the symptom, but it's not actually fixing anything. It's just masking those symptoms. And the problem with neuropathy is, most people know, is it's progressive. It gets worse over time. And so that's where we come in. We want to stop that progression. We want to keep people driving, keep people walking, keep people having a good quality of life.
Okay, so you're saying the medications aren't fixing the problem?
Not one bit.
Okay, so what are you doing differently?
So in our office, we want to fix that cause. And one of the big things that happen with neuropathy is a lack of circulation, decreased blood flow going to the feet and the legs, decreased blood flow going to your hands. The nerves, the tissues, they start to die off. And so to fix that, one of the biggest, newest things that we're doing in the office is stem cell therapy for neuropathy.
Okay, and we've heard of stem cell therapy before, Dr. Weller. So what is different about the type of therapy that you're doing?
So there's a few different forms of stem cell therapy out there, and two of the biggest ones are we're going to take it from your own fat, your bone marrow, spin it down, put it back in you.
Okay.
That's great. It's great for a lot of conditions. We don't do that in the office. What we use is placental tissue, amniotic tissue, cord blood. And so that comes from donating mothers right after birth. It's FDA regulated, it's perfectly safe, and it's effective. That's the biggest thing, that we're seeing the best results with this product.
Well, why is that type of cord blood or placenta better than our own blood?
Well, who heals better, a brand new baby or you right now and me?
I can tell you right now, it ain't me.
Right? I have 8-year-old girls. Anytime they get cut, I mean, they heal up in days.
Right.
And so we're starting to see results that fast. Within days, these people's pain is down to from a 10 to a 0.
Wow.
We're seeing 60 to 100% improvement within weeks to a month's time, as opposed to taking years for this stuff to heal.
Okay, so here's what you're going to do. In your special offer, you're offering up a free consultation and
Yes.
an exam. Are you able to determine, is everybody a good candidate for this type of treatment?
No, unfortunately, because it's progressive, it gets to stages where it's too far gone, right?
Okay.
We want people coming in early on. It's not that I can't help the person that's already in the wheelchair, but if you got just a numb toe, you just started noticing this 2 months ago, right now is the easiest, cheapest, fastest, quickest time to get better than waiting till it's worse.
And a lot of people know that this isn't covered by insurance. It can
Right.
be expensive. So how do you quantify that?
You know, our average patient's 75 years old. They're on a fixed income, they're living off of Social Security. We make the care affordable for the patients that we can get better and we really truly want to, really truly can help. Also, most of the time it's cheaper than the medication. We have patients coming in spending $400, $1,000 a month on medications.
Wow.
This is much cheaper than that.
Well, Dr. Weller, you have really given us a lot of good information because you know if you suffer from neuropathy, the pain, it can just be overwhelming. So here is the special offer that he has brought for you. This is for the first 25 callers who call into his office. He's going to give you a free exam and a free consultation to find out if you are a good candidate for this procedure. Here's that number to call, 480-447-9555. Learn more off the website. It's restorenervehealth.com.